Hello, today I'm speaking to Dr. Kenneth Enwerem. He's going to tell us about sickle cell disease and his own personal stories. This is Dr. Enwerem.
Hello, you're welcome.
What is sickle cell anemia?
I can see the paper, man.
What is sickle cell anemia and who is affected by it?
Sickle cell anemia is a genetic disease, genetic blood disease that is inherited from parents to child and affects a component of the blood called the hemoglobin. It mostly affects people of black descent, most commonly those in sub-Saharan Africa. It also affects those in some part of Asia, India, and the Mediterranean. So that's basically what sickle cell is and those that are affected.
What causes sickle cell disease and what are the myths and the misconceptions and the links to malaria?
Okay, sickle cell disease, like I said, it's a genetic disease. When a parent or both parents carry hemoglobin S trait in them, they can pass it down to their offspring, and that is how the offspring gets sickle cell anemia when he gets hemoglobin S from each of the parents. There are certain myths and misconceptions about sickle cell anemia because of lack of knowledge of sickle cell anemia in rural settings. Let me use Nigeria for example. People believe that those that have sickle cell probably die before the age of 20 or 21, which is not true, because I have sickle cell anemia and I'm 33 years old. People also believe that people that have sickle cell anemia are children of river goddess, something like that. They have specific names, they call them in Nigeria, which denotes that they're either children born out of reincarnation or children that are a punishment from the gods or something like that. But these are just misconceptions that people have because of the paucity of the knowledge that they have about sickle cell disease. And talking about link to malaria, it was believed that very long time ago, I'm talking about millions of years ago, there was no hemoglobin S. But because malaria was ravaging and killing people in places like sub-Saharan Africa, the body's red blood cells underwent a kind of evolution and mutation, and then the hemoglobin A was mutated to a hemoglobin S, which was good because when someone is a carrier, I mean if the person is AS, the person is protected more from the complications of malaria. But when the S combines in a homozygous form, that's SS, that is now hazardous to human health. That's what produces the sickle cell disease. So that is how sickle cell has been linked to malaria. And so if you look around the areas of the world where there is sickle cell, it's mostly in those areas that also have malaria, like sub-Saharan Africa, the Mediterranean, places in India and Asia. Yes, so that's the link that sickle cell has with malaria.
How can the disease be managed?
Let's talk about the signs and symptoms before we talk about the management. People that have sickle cell anemia, usually the first symptom that a child usually presents with when they have sickle cell anemia is hand and foot swelling. You notice that probably from 6 months of age, a child with sickle cell anemia develops very severe pains in his hands and his legs and swelling and redness, which ushers in a manifestation of the disease. We call it vaso-occlusive crisis in medical terms, and these pains are said to be very excruciating. They can only be compared to a pain a woman has during labor. So, and then anemia, which is shortage of blood, is also another presentation they have. That's actually where the name sickle cell anemia came from, because they usually have very low blood levels, because the blood of someone with AA usually lasts for 120 days before it's lyses and new ones are formed. But for someone with sickle cell anemia, their blood stays for maybe like 15 to 30 days before it lyses. So they are constantly having low level of blood in them. They could also have jaundice, which is yellowness of eyes due to excessive breakdown of red blood cells, and then they can have pains in any part of their body, which is the painful crisis that is characterized sickle cell disease. Then they can have complications. Any organ in their body can be damaged due to the blockage of the vessels by the sickle red blood cells. They can have strokes, they can have kidney problems, they can have heart problems, blindness. Any part of their body can really be affected. They can also have things that look like bone deformities. So a barrage of things can happen. The management of sickle cell anemia is usually palliative. It means we manage the symptoms. Because it's a disease affecting the genes. It's genetic. It's not like malaria or other things that you treat the organism causing it. So it's genetic. So you just manage the symptoms. So when the person has pains, you give analgesic or painkillers. When the person has malaria, you treat for malaria. Usually we give them malaria prophylaxis to even prevent them from having malaria in the first place. When the person has infection, you treat infections. When the person is dehydrated, you make sure the person gets enough water. So you just treat around the symptoms. However, sickle cell disease has a cure, which is called bone marrow transplant. It's like a replacement of the bone marrow of the affected person, because the red blood cells are produced from the bone marrow. So the bone marrow of the affected person is removed, and the bone marrow from someone who is AA is used to replace that. But it has its own complications. It's expensive, and some people that undergo the procedure do not survive it. So that's basically management.
Why do you think sickle cell can be prevented?
Yes, prevention is very, very key in sickle cell anemia because of the cost of having the disease in the first place. So prevention is because for an individual to have sickle cell disease, he or she have to have hemoglobin S, inherited one from each parent. Therefore, if people are counseled about sickle cell disease and know what it is, know their genotype before they enter into relationships, they can make informed decisions of not getting into relationships that will lead to them having a child with sickle cell disease. That means someone that has a trait will be cautious to go into a relationship with another person that has a trait, because there is a possibility that they can have a child with sickle cell disease. So that's the way to prevent sickle cell disease, by knowing your genotype and making informed decisions before you walk into any relationship that might produce a child with sickle cell anemia.
Why did you start the Omega Cares Foundation?
Okay, like I said before, I have sickle cell anemia. In my final year in medical school, I had a very terrible crisis, the worst I have had in my life, and I almost died. In fact, I would say I died and came back, and after that incident, I determined that God spared my life for a reason. So I will dedicate my life to advocating for sickle cell disease, ensuring that people that have sickle cell disease get adequate care, and ensuring that people make informed decisions before they walk into relationships. So that is actually what stimulated my passion to form this charity for sickle cell anemia called Omega Cares Foundation. It actually, the idea came in 2006, but we actually started the charity in 2010 back in Nigeria, and in this 2-year period we've been able to actually do a lot in terms of creating awareness about the disease, ensuring people seek genetic counseling before they walk into relationship, and also before they get married. And also we run a sickle cell clinic where kids with sickle cell anemia receive daycare treatments when they have probably some kind of sickle cell crisis or infection or malaria or whatever. As long as they have sickle cell anemia, we treat them free of charge in our clinic. So those are the programs we run in Omega Cares Foundation, and we look forward to probably having them have bone marrow transplants in the future, and things like that.
Great. You've been listening to Dr. Kenneth Enwerem. I hope this information he's giving you today is going to help you understand what sickle cell anemia is. Please support Omega Cares Foundation and Hidden Desires Foundation to eradicate sickle cell from Africa. Thank you.